Bronchiectasis is a chronic lung condition where the airways, called bronchi, become damaged, widened, and thickened. This damage makes it harder to clear mucus from the lungs, leading to repeated lung infections, inflammation, and breathing difficulties. Over time, it can cause scarring and impair the lung's ability to function properly. Causes of bronchiectasis. Bronchiectasis can be caused by conditions that damage the airways or impair mucus clearance. These include 1. Infections. Severe respiratory infections like pneumonia, tuberculosis, or whooping cough can cause long-term damage to the bronchi. 2. Chronic lung conditions. Chronic obstructive pulmonary disease, COPD, chronic inflammation and damage to the lungs. Asthma can cause airway inflammation and mucus buildup. 3. Congenital conditions. Cystic fibrosis, a genetic condition causing thick, sticky mucus that clogs airways. Primary ciliary dyskinesia, a condition where the tiny hair-like structures, cilia, in the lungs don't work properly, impairing mucus clearance. 4. Immune system disorders. Conditions that weaken the immune system, e.g., HIV, autoimmune diseases, can increase susceptibility to lung infections. 5. Allergic bronchopulmonary aspergillosis, ABPA, an allergic reaction to a type of fungus that can cause airway damage. 6. Other causes. Inhalation of foreign objects, chemical irritants or toxins. Rare genetic disorders like alpha-1 antitrypsin deficiency. In some cases, the cause of bronchiectasis remains unknown. Idiopathic bronchiectasis. Symptoms. Symptoms can vary in severity and may develop gradually over months or years. Common symptoms include 1. Persistent cough. Often produces large amounts of thick, yellow or green mucus, sputum. 2. Frequent chest infections. Recurrent respiratory infections that may worsen symptoms. 3. Shortness of breath. Difficulty breathing, especially during physical activity. 4. Wheezing. A whistling sound when breathing due to narrowed airways. 5. Chest pain or discomfort, often due to inflammation or infection. 6. Fatigue. Feeling tired due to poor oxygen exchange and repeated infections. 7. Clubbing. Enlargement or rounding of the fingertips, often seen in chronic lung conditions. 8. Hemoptysis. Coughing up blood, which may occur during infections or when airways are inflamed. Diagnosis. Diagnosing bronchiectasis involves assessing symptoms, medical history, and imaging tests to confirm airway damage. 1. Medical history and physical exam. Discussion of persistent cough, infections, and underlying conditions. Doctors may listen to the lungs for abnormal sounds, such as crackles or wheezing. 2. Imaging tests. High-resolution CT, HRCT scan. The most accurate test shows widened airways, thickened walls, and mucus buildup. Chest X-ray may show abnormal lung structures, but is less detailed than a CT scan. 3. Sputum tests. Analysis of mucus to identify infections or bacteria causing lung damage. 4. Lung function tests. Spirometry measures how well the lungs are working and detects airflow obstruction. 5. Blood tests. Checks for underlying immune system issues, infections, or genetic conditions. 6. Sweat test or genetic testing may be done to diagnose cystic fibrosis if suspected. Treatment. Treatment focuses on managing symptoms, preventing infections, and improving quality of life. While bronchiectasis cannot be fully cured, effective treatments can minimize its impact. 1. Airway clearance techniques. Chest physiotherapy helps loosen mucus, making it easier to cough up. Postural drainage. Specific body positions to drain mucus from the lungs. Breathing exercises. Techniques to improve mucus clearance and lung function. 2. Medications. Antibiotics. To treat or prevent infections, may be oral, inhaled, or intravenous. Bronchodilators. Relax airway muscles and improve breathing. Mucolytics. Help thin mucus, making it easier to clear. Steroids. Inhaled or oral corticosteroids to reduce inflammation, used cautiously. 3. Vaccinations. Regular flu and pneumococcal vaccines to reduce the risk of infections. 4. Treating underlying conditions. addressing causes like asthma, COPD, or immune deficiencies. 5. Oxygen therapy, for severe cases where oxygen levels are low. 6. Surgery, rare, removal of severely damaged parts of the lung if other treatments fail and symptoms are localized. Complications. If untreated or poorly managed, bronchiectasis can lead to complications such as 1. Repeated lung infections. 2. Respiratory failure. 3. Hemoptysis, severe coughing up blood. 4. Collapsed lung pneumothorax. 5. Heart problems, e.g., cor pulmonale, due to increased strain on the heart. Living with bronchiectasis. 1. Lifestyle changes. Avoid smoking and secondhand smoke. Stay physically active to improve lung capacity. Eat a balanced diet to support the immune system. 2. Hydration. Drinking plenty of fluids can help thin mucus. 3. Monitoring symptoms. Seek medical help for worsening symptoms or new infections. 4. Support groups. Joining a support group or connecting with others living with bronchiectasis can help manage the emotional and physical challenges. Prognosis. With proper management, many people with bronchiectasis lead active lives. Severe cases may require ongoing medical care to prevent complications and maintain lung function. Early diagnosis and treatment are key to slowing disease progression and improving quality of life.